Welcome, Dr. Nisen. As you know, Lunder-Dineen Health Education Alliance of Maine mission and vision is to improve health through health education. And we believe health education is powerful medicine. We are so appreciative of your experience being a longtime Maine family physician and now Chief Medical Officer of Penobscot Community Healthcare. You serve as an important advisory committee member to Lunder-Dineen and now partnering with Lunder-Dineen and others to help lead an effort to address a gap in alcohol assessment and treatment. So, Dr. Nisen, what do we need to know about alcohol use in Maine?
I think most people, most providers and their teams, and in fact most people understand the importance of alcohol use and problem alcohol use on the well-being of Mainers and see this in their lives, in their families, or in their communities on a regular basis. On the other hand, the structure of the medical delivery system hasn't fully addressed this challenge yet. Up to a third of the visits that we see in primary care may be directly or indirectly related to problem alcohol use, and perhaps half of hospitalizations are directly or indirectly related. So it's a big problem, and a problem that we're pleased to be able to support practices in addressing more fully.
What challenges do healthcare providers face if they choose to address unhealthy alcohol use?
An initial barrier is the stigma attached to addiction. Most of us, many of us I should say, are uncomfortable dealing with addiction or raising it as a possibility with patients, and so we often wait for really clear evidence that it may be a problem for this patient. I remember a patient I had in my private practice who had poorly controlled blood pressure and some other health challenges that we were just having trouble managing effectively. And it wasn't until I made a house call for his wife, who had an acute illness and couldn't leave the home, that when I walked into the home and looked in the garage, it was filled with empty beer cans. And so it gave me an opportunity to ask that family whose those were. It was my patient's, the husband's, who was having the challenging health problems. And at that point, it was like a threshold that I could cross and start to discuss that with him, engage in that with him. And I think we overestimate the patient barrier to having those discussions. I find that patients aren't as sensitive about raising these issues as we fear they may be, and that the hesitation is largely on the part of the providers and their care teams.
So that's encouraging, very encouraging to hear that there's some simple things that we all can do to address alcohol use in primary care visits. What should we know about what happens to us when we do overuse alcohol?
Well, again, I think many lay people and most providers are aware of the individual impact of problem alcohol use, that is the health impact. And so there's the immediate risks of inebriation, the poor judgment that's associated with that, the being prone to accidents or injury, and then the longer-term health effects. People are aware of liver disease and of potential brain damage from chronic alcohol use, but there are also the social impacts. And so there's a profound impact on the person themselves who's using alcohol in an unhealthy way, on their family members and loved ones. In fact, we know that children raised in a home with a parent who's dealing with substance abuse suffer both emotional, long-term emotional, lifelong emotional, and lifelong medical impacts of having that stress early in their life. There also is an economic impact, and so the inability to work regularly or to work effectively or efficiently may cause economic, financial problems for the household, but also for the business. And so businesses who are losing productivity, losing efficiency because of people with substance abuse challenges also ought to be concerned about this problem.
Alcohol misuse really has a broad impact, and it sounds like awareness and education are two of the areas that we need to focus on. How does Lunder-Dineen, this pilot project that we're working on, how does it add value and how does it benefit the primary care team?
Well, what I think is exciting about this pilot is that it really is designed to work in a real-world situation. So it's designed to fit into a primary care setting without adding a lot of time burden, offering fairly simple, straightforward educational processes and supports to help people deal with this. And so there's formal education in a very succinct manner to help people understand what are evidence-based approaches to problem alcohol use, including the prescription medications which can help in these circumstances, which is something that most primary care providers perhaps don't fully understand or don't have confidence in their own ability to carry out. And that education may be available for their teams as well. There is support designed into the program from a mentor, from somebody with vast experience in this field and in the use of these medications. So they're there as a lifeline for accessing, for calling and speaking to that person about a challenging case or circumstance, about workflow processes. And then there's ongoing support to help people be able to continue to do this in an important and effective manner.
Great. Thank you so much for your time, your insight, and solutions.
It's a pleasure, Denise.